Compared to Westerners, East Asians generally have more pronounced irregularities in their facial contours. It feels more severe, the cheekbones are large, and because of them, the peanut-shaped face becomes more emphasized. As a result, the face... Hello, I'm Kyung-Kook Hong from Clinique. In this session, I'll show how to perform a procedure called contour fixation using a product called Aptos. And I'll talk about why this design is best suited for East Asians. When doing this, it should look natural. The cheekbones shouldn't get bigger, but the effect must be clear. So let's take a moment to find out, together, exactly how we can successfully achieve all three of those important goals, shall we? This is the design from Aptos headquarters. As you can see, it directly targets three interfacial areas: nasolabial fat, upper jowl, and lower jowl, to reposition fat in a biolifting method. If you target the interfacial area too much, it can look temporarily unnatural for East Asians, as you can see, and they might say their face looks wider. Of course, this improves 100% over time, but why does this happen? Compared to Westerners, East Asians generally have more pronounced facial irregularities in their contours. The cheekbones are large, and because of them, the peanut-shaped face is more emphasized. As a result, the face feels more saggy. Simply put, we can divide the face into inner and outer contours. The inner part is the dynamic area. It's the area responsible for three-dimensional volume when blinking, speaking, eating, or looking from the front or side. Next, the outer part is responsible for our facial frame and contour. But as we age, this outer frame collapses, and then naturally, the connected inner part collapses as well. So the current lifting trend, or the trend for collagen stimulators, is a procedure called contour fixation. Simply put, the face is divided by retaining ligaments, and if the outer contour is improved, this force is transmitted to the inner part through the ligaments, creating a lifting effect. This is a method of contour fixation that uses collagen stimulators such as Redefine to help enhance facial features. It is introduced from the cheekbone area and works to improve the upper facial region, fill in cheek hollows, and refine the jawline for a more balanced appearance. This is good for improving the outer contour, but as you can see, it would be even better if we lifted and repositioned the jowl area more. So how can we achieve this? When I thought about it, I felt that by using Aptos, we could achieve both of those effects. By slightly modifying this design method, focusing on the uneven outer contours and targeting the jowls or nasolabial folds the patients are concerned about, we can simultaneously gain the benefits of contour fixation plus the lifting effect. Now, many people talk about collagen, but if there's only collagen in the face, it becomes hard like scar tissue. So collagen isn't everything. Elastin and other skin components become very important, and in this regard, contour fixation lifting using Aptos can be said to be a bit different. Why? It's because in the early stages, the hyaluronic acid in Aptos suppresses excessive foreign body reactions and inflammation, and in the later stages, it has the advantage of promoting autologous ECM generation. If we briefly look at the results, we can see that the facial lines have become really smooth. And when looking at whether this also has a contour fixation effect, if you look at this patient's far right photo, the blue area is the sunken part. And by creating a bit of volume, this design shows the orange and yellow areas where the volume has been lifted upwards. Similarly, we can see that the skin improves significantly. Skin texture, redness, and skin tone as well. Why? It's because of this biostimulating effect, especially since Aptos contains HA. Other patients also show the same effect. For contour fixation, volume is added where needed, and then the areas to be lifted are pulled up. So we can see the effect where the volume moved up from yellow to blue, literally being physically lifted. And similarly, we can see that skin texture, redness, and skin tone have improved a lot. So the contour fixation lifting we mainly do, to put it simply, is the effect of contour fixation using collagen stimulators like Redefine, which means improving the outer contour plus lifting through the repositioning of jowl and nasolabial fat. And with the sequential release of hyaluronic acid, it minimizes the side effects of polymers and additionally maximizes the ECM regeneration effect. In short, it's a procedure that can simultaneously achieve these three effects: contour fixation, lifting, and skin improvement.
Thank you.